So, hello, my name is Patricia Rose De Leon, and today I'll be doing the ninth reading assignment for the class Introduction to Human Physiology. So, this will be a think aloud assignment where I won't show any of my annotation process, but I'll only show my thought process in this video. So, I believe the topic for this assignment will be cardiac cycles, and it will go over the atrial systole, ventricular systole, the cardiac cycle, and volume changes during the cardiac cycle. We also have a figure here that shows the cardiac cycle, the relaxation period, and the last one is heart sounds. Okay, since I have a lot of information to go through, I will just get started right away. So I will begin in cardiac cycles right here at 20.4. Objectives: describe the pressure and volume changes that occur during a cardiac cycle. Relate the timing of the heart sounds to the ECG waves and pressure changes during the systole and diastole. A single cardiac cycle includes all the events associated with one heartbeat. Thus, a cardiac cycle consists of a systole and a diastole of it got cut off here, but it says atria plus systole and diastole of the ventricles. So, as we all know from anatomy class, the cardiac cycle is basically this series of pressure changes that take place within the heart, and because of these pressure changes kind of result in like the movement of blood throughout different chambers of the heart and the body as well. So pressure and volume changes during the cardiac cycle. um okay, so in this part, the leftmost section of the PDF is cut off, but I will try my best to um read this paragraph right here. So, I believe that's each cardiac cycle, the atria and ventricles alternately contract and relax, forcing blood from areas of higher pressure to areas of lower pressure. As a chamber of the heart contracts, blood pressure um, within it increases. Figure 20.14 shows the relation between the heart's electrical signals, or ECG, and changes in atrial pressure. Um, Ventricular pressure, aortic pressure, and ventricular volume during the cardiac cycle. The pressures given in the figure apply to the left side of the heart. Pressures on the right side are considerably low. Each ventricle, however, expels the same volume of blood per beat, and the same pattern exists for both pumping chambers. When heart rate is 75 beats per minute, a cardiac cycle lasts 0.80 seconds. To examine and correlate the events taking place during the cardiac cycle, we will begin with the atrial systole. Okay, so basically what it's trying to say is that with pressure changes um, at the end of a diastole, there is basically this small amount of extra blood that is contracted into the ventricles. So this increases like the ventricles pressure so that it has like it's higher than it is in the atria, which causes some of the valves to close. So there's also this decrease in the total heart volume, and basically, I believe this is the first part of the cardiac cycle, which is the systole, and there is also this kind of recovery in volume at the later part of the cardiac cycle. So basically, the changes in the heart volume um, by flow measurements was like set to begin at like the volume of the heart, which is obtained from volumetric method. Okay, so moving on to the atrial systole. During atrial systole, which lasts about zero point seconds, the atria are contracting. At the same time, the ventricles are relaxed. Number one, depolarization of the SA node causes atrial depolarization, marked by the P wave in the ECG. Atrial depolarization causes atrial systole. As the atrial contract, they exert pressure on the blood within, which forces blood through the open AV valves into the ventricles. Number 3. Atrial systole contributes a final 25 milliliters of blood to the volume already in each ventricle, about 105 milliliters. The end of the atrial systole is also the end of the ventricle diastole, or relaxation. Thus, each ventricle contains about 130 milliliters at the end of its relaxation period, diastole. This blood volume is called the end diastolic period, or EDV. And number 4, the QRS complex in the ECG marks the onset of the ventricular depolarization. Okay, so basically the atrial systole, it lasts about zero point 0.1 seconds, which means both the atria contract and it forces the blood from the atria um into the ventricles. So prior to the atrial systole, blood has already been flowing passively from the atrium into the ventricle through the open AV valve. So during the atrial systole, the atrium, as I mentioned before, contracts and like tops off the volume in the ventricle with only like a small amount of blood. So yeah, basically atrial contraction is complete before I believe the ventricle begins to contract. So moving on, the ventricular systole. During ventricular systole, which lasts about zero point 0.3 seconds, the ventricles are contracting. At the same time, the atria are relaxed in the atrial diastole. Number 5. Ventricular depolarization causes ventricular systole as ventricular systole begins. Pressure rises inside the ventricles and pushes blood up against the atrioventricular or AV valves, forcing them shut. For about zero point zero 0.05 seconds, both the SL or the semilunar and AV valves are closed. This is the period of isovolumetric contraction. During this interval, cardiac muscle fibers are contracting and exerting force but are not yet shortening. Thus, the muscle contraction is isometric or same length. Moreover, because all four valves are closed, ventricular volume remains the same, or isovolumic. Number 6. Continued contraction of the ventricles causes pressure inside the chambers to rise sharply. When left ventricular pressure surpasses aortic pressure at about 80 millimeters of mercury, and right ventricular pressure rises above the pressure in the pulmonary trunk about 20 millimeters of mercury, both SL valves open. At this point, ejection of blood from the heart begins. The period when the SL valves are open is ventricular injection and lasts for about 0.25 seconds. The pressure in the left ventricle continues to rise to about 120 um, millimeters of mercury, whereas the pressure in the right ventricle climbs to about 25 to 30 millimeters of mercury. Okay, so a few things. Um, so in here at ventricular systole, we have the isovolumetric contraction, and basically what it is that this is basically like an event that occurs in the early systole, during which like the ventricles contract without any corresponding volume change. And the other one is ventricular ejection, is basically referring to like how well your left ventricle or um your right ventricle pumps blood to like each heartbeat. So most of the time the ejection refers to like the amount of blood that is being pumped out of the left ventricle each time it like contracts. So yeah. And just a quick note, the left ventricle is the heart's main pumping chamber. So moving on, number 7, the left ventricle ejects about 7 milliliters of blood into the aorta, and the right ventricle ejects the same volume of blood into the pulmonary trunk. The volume remaining in each ventricle at the end of the systole, about 60 milliliters, is the end systolic volume, ESV. Stroke volume, the volume ejected per beat from each ventricle, equals and diastolic volume minus end systolic volume, or SV is equal to EDV minus ESV. At rest, the stroke volume is about 130 milliliters minus 60 milliliters is equal to 7 milliliters, a little more than 2. Oh, yeah. And last one is that the T wave in the ECG marks the onset of ventricular repolarization. So, last term mentioned in the ventricular systole is the end systolic volume. So basically, this is like is referring to like the volume of blood in like the left or right ventricle at the end of the systolic ejection phase. So this happens immediately before like the beginning of the diastole or the ventricular filling. So basically, ventricular systole it refers to this. In summary, it refers to this period of like contraction of the ventricles, and basically there are like electrical impulses that arrived at the AV nodes that shortly after the atria has been depolarized. And yeah, I think there is a small delay at the AV node, which kind of like allows the atria to complete contraction before the ventricles are depolarized. So before I move on to the relaxation period and the last topic in heart sounds, I think I will look over this figure 20.14 because it has been referred here in the first parts of the text. And yeah, so figure 20.14, cardiac cycle. A ECG, B changes in the left atrial pressure, green line, left ventricular pressure, blue line, and aortic pressure, red line, as they relate to the opening and closing of heart valves. C, heart sounds, so you can see here the wavelengths. D, changes in left ventricle volume, and E, phases of the cardiac cycle. So, okay, so let's look at the ECG first. So it looks like P. This is the P waves, which is I think a sign of atrial excitation, which is followed by a QRS complex, and I think it shows a sinus rhythm. And yeah, if the P waves are irregular, basically I think there's a sinus arrhythmia present. And I'm not sure what T is. I think I have to look that up. So basically, in at letter B, it shows the pressure changes and I think kind of like the important events within the cardiac cycle. And I think this is just one cycle. Um, yeah. So C is heart sounds. B, D is the volume in the ventricle. And the last one, which is the phases of the cardiac cycle. And it looks like the first one is the atrial contraction, which basically it forces blood into the ventricles. Second one is the isovolumetric contraction, which is the it pushes the AV valves closed. The ventricular ejection, the valves are open and the blood is ejected. Isovolumetric relaxation, um, ventricular filling, um, which closes the blood, which closes the valves and the blood flows into the atria. And I think this is the last one, atrial contraction. Oh wait, this what I mentioned earlier was for this one, but I think this is just a cycle. And the last one is the ventricle filling, which I think the chambers relax and the blood fills ventricles passively. So yeah, I might as well try to answer this question right here. So how much blood remains in each ventricle at the end of ventricular diastole in a resting person? What is this volume called? Okay, I think it was mentioned earlier, but um, so the amount of blood that is in each ventricle at the end of a ventricle diastole, I think that's called the end diastolic volume. And And for the question, how much blood remains in each ventricle at the end of a ventricular diastole in a resting person, I think that's 130 milliliters in a resting person. Okay, so now that we have that out of the way, we can move on to the relaxation period. So during the relaxation period, which lasts about zero point 0.4 seconds, the atria and the ventricles are both relaxed. As the heart beats faster and faster, the relaxation period becomes shorter and shorter, whereas the durations of the atrial systole and the ventricular systole shorten only slightly. Okay, so I believe this is number 8. Ventricular repolarization causes ventricular diastole. As the ventricles relax, pressure within the chamber falls, and blood in the aorta and pulmonary trunk begins to flow back toward the regions of lower pressure in the ventricles. Backflowing blood catches in the valve cusp and closes the SL valves. The aortic valve closes at a pressure of about 100 millimeters of mercury. Rebound of blood of the closed cups of the aortic valve produces the necrotic wave and the aortic pressure curve. After the SL valves close, there is a brief interval when the ventricular blood volume does not change because all the four valves are closed. This is the period of the isovolumetric relaxation. As Number 9, as the ventricles continue to relax, the pressure falls quickly. When ventricular pressure when ventricular pressure drops below the atrial pressure, the AV valves open and the ventricular filling begins. The major part of ventricular filling um, occurs just after the AV valves open. Blood that has been flowing into and building up in the atria during the ventricular systole then rushes rapidly into the ventricles. At the end of the relaxation period, the ventricles are about three-quarters full. The P wave appears in the ECG, signaling the start of another cardiac cycle. So, a few terms in this period. First is the ventricular diastole, which is basically this kind of period where the two ventricles are they're relaxing from contractions, and then they're dilating and filling. And the necrotic wave is Um, um, so, yeah. Basically, it happens because when there's pressure within the ventricle, that drops below pressure in both like the pulmonary trunk and the aorta. And that happens when the blood flows back to the heart, which produces the necrotic wave, which is seen in the blood pressure tracings. And isovolumetric relaxation is basically when the ventricular pressure drops below the diastolic aortic and pulmonary pressures, and the aortic and the pulmonary valves close, which produce the second heart sound. And I think this kind of marks the beginning of the diastole. And last term mentioned here is the um, ventricular filling, which basically when the AV valves open, the ventricular feeling starts. So I think this is kind of it results from like ventricular untwisting, and then it returns from like each ventricular muscle fiber to its like slack length. So in summary, the relaxation period is so basically in summary the relaxation period it occurs as the chamber fills with blood, which is called the diastole. Um, yeah, and the systole in the contraction phase of like the cardiac cycle, and the diastole is basically what the relaxation phase is. Um, so yeah, moving on, heart sounds. I can't make out what it is, but it says here it's auscultation, or also known as listening. It's just the act of listening to the sounds within the body, and it's usually done with um, a stethoscope. Which so the sound of the heartbeat comes primarily from the turbulence caused by the closing of the heart valves. Smoothly flowing blood is silent. Compare the sounds made by pristine water rapids or a waterfall with the silence of a smoothly flowing river. During each cardiac cycle, there are four heart sounds, but in a normal heart, only the first and the second sounds, S1 and S2, are loud enough to be heard through a stethoscope. Figure 20.14c shows the timing of the heart sounds relative to the events in the cardiac cycle. The first sound, or S1, which can be described as a lub sound, is louder and a bit longer than the second sound. S1 is caused by the turbulence associated with the closure of the AV valves soon and the ventricular systole begins. The second sound, or S2, which is softer and is not as loud as the first, can describe as a dub sound. S2 is caused by the blood turbulence is associated with the closure of the SL valves at the beginning of the ventricular diastole. Although S1 and S2 are due to the blood turbulence associated with the closure of the valves, they are best heard at the surface of the chest in locations that are slightly different from the locations of the valves. Figure 20.15. This is because the sound is carried by the blood flow away from the valves. Normally not loud enough to be heard, S3 is due to blood turbulence during rapid ventricular filling, and S4 is due to blood turbulence during atrial systole. So basically, the first heart sound, or S1, it kind of results from the closure of the mitral and the tricuspid valves, and yeah, it's produced by the closure of the mitral valve and the tricuspid valve. And the second one, which is the heart sound, second sound, um, it's caused by the closure of the semilunar or the aortic and pulmonary valves, and yeah, and the third valves, the third sounds due to rapid ventricular filling, and S4 due to atrial systole. So, clinical connection heart murmurs. Heart sounds provide valuable information about the mechanical operation of the heart. A heart murmur is an abnormal sound consisting of clicking, rushing, and gurgling noise that is either heard before, between, or after the normal heart sounds, or may mask the normal heart sounds. So, heart murmurs in children are extremely common and usually do not represent a health condition. Murmurs are most frequently discovered in children between the ages of 2 and 4, and these type of heart murmurs are referred to as innocent or functional heart murmurs. They often subside or disappear with growth. Although some heart murmurs in adults are innocent, most often an adult murmur indicates a valve disorder. When a heart valve exhibits stenosis, the heart murmur is heard but the valve should be fully open but is not. For example, the mitral stenosis produces a murmur during the relaxation period between S2 and next S1. An incompetent heart valve by there it is. Okay, so um, yeah, basically the heart murmurs this kind of sound blood flowing to the heart, which is due to like anything from like a healthy heart exertion during exercise, or maybe like an abnormality in valves or heart disease. So figure 20.15 heart sounds, location of valves blue, and auscultation sites red for heart sounds. So basically, this is the um, area in which most physicians look for sounds when they use the stethoscope. So they look one the aortic valve, the tricuspid valve, the pulmonary valve, and the bicuspid valve. I think that for this question, which heart sound is related to the blood turbulence associated with closure of the atrioventricular valves, I believe that is the first heart sound, or the S1, because it represents like the closure of the atrioventricular valves as the ventricular pressures exceed atrial pressures at the beginning of a systole. Yeah, S1 is normally like a single sound because like the mitral and the tricuspid valve closure occurs like almost simultaneously. Okay, so before I end the video here, as always, I have a few questions and maybe a clarifications as I've read through the text, and I will first begin at the cardiac cycle and the pressure and volume changes during the cardiac cycle. Okay, so my first question is, which is connected to something kind of general whenever we visit doctors, physicians, is that how do the blood pressure numbers, what do they mean, and how do they kind of relate to each other? So basically, like, let's first say if you've been healthy and you went to the doctor and you got a BP of like 104/68 and told that like it was healthy, but um um yeah, I do kind of get confused. If it, like, sometimes would it be better to be 104/80 or like 104/60? So yeah, I think I just wanna point that out in here. And for the what else? The heart sound. So for heart sounds, when a doctor kind of listens to your heart using a stethoscope, what are they actually looking for? Like, how do they indicate if abnormal changes or like irregular rhythms in your heart do kind of signify that there is problems with the blood flow or the valves as a whole? Okay. So that is all for my Think Aloud assignment, reading assignment number 9, and 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 yeah, if you have, if for some reason you're unable to access the video, uh, please let me know through um, emailing me in Canva. But if you have any questions, comments, or concerns about the topic as a whole, please also let me know. So yeah, thank you so much for listening to my Think Aloud video, and have a nice day.